There are a few clinical conditions whose diagnosis we are not expected to miss. One of these is oral ulcers, which are most common painful diseases affecting oral mucosa. With these words, I am Dr. Manish and I welcome you all to another interesting clinical video on Aphthous ulcers. So let's start. A 16-year-old boy weighing 46 kilos presented with complaint of painful lip for 2 to 3 days. There is history of similar complaint in past. There is no history of intake of drugs like NSAIDs. There is history of similar complaint in other family members. On examination, single shallow ulcer is present on labial mucosa opposite left upper second incisor. Ulcer is shallow, covered with a yellowish white membrane and surrounded by sharp borders and slightly elevated bright red areolae. Ulcer is tender. Based on presenting complaint and examination findings, a diagnosis of Aphthous ulcer is made. Whenever you see patients with painful solitary shallow ulcers with history of similar complaint in past, do think of Aphthous ulcers as the first diagnosis. Aphthous ulcers are believed to be multifactorial in origin, and the best part about them is that in majority of cases, the etiology remains unknown. Treatment consists of topical corticosteroids and analgesics. Ulcer has healed completely without scarring. That's all for now in this video. If you have any queries or suggestions, then do post in the comment section below. If you haven't liked or shared yet, then do like and share this video and don't forget to subscribe. Thank you.